Good morning, everybody. Today we are discussing about the management of medical emergencies part 2. So, in the initial part, we discuss few of the medical emergency. In the part 2, we are discussing about the arterial insufficiency, seizures, hypoglycemia, hyperventilation, asthma, anaphylaxis, like that. So, in this topic, we will be aware of the signs and symptoms of each and medical emergencies. It could happen any time in the dental office, so we will be aware of this medical emergency and how can we manage in the dental office, and how will you manage know about the basic lines of the food and what are the emergency medications and calling for the assistance, etc. The first one, we will be the insufficient true medical emergency that the victim is in a immediate danger of death due to the peripheral vascular collapse or shock and a ventricular assist or cardiac arrest. Already we discussed for the regarding the endocrine system, the same thing. What are the things we will see in acute adrenal insufficiency? The first one is called the role of blues. Prevention is adrenal corticosuppression should be suspected if a patient have received therapy to choose the following methods. That means if the patient is taking steroid therapy for a longer duration, then there will be an acute adrenal crisis will happen. So what are the things we see mostly in this type of patient? The patient is taking a dose of 20 mg or more than steroids or its equivalent. They taking via through orally or pedally, means IV or IM. The continuous period of more than 2 weeks or longer. That means the patient is taking orally or pedally steroids for more than 2 weeks or higher, or patient will be taking 2 years of dental therapy. Then, so this type of patients with acute adrenal insufficiency. So the fact is the return of adrenocortical function after exercise of glucocorticoid therapy. That means the dosage of glucocorticoid administered, duration of the course of therapy, the frequency of the administration of the drugs, time and route of administration. The adrenal suppressions that result from the exogenous cortisol that can may prevent the normal release of the endogenous cortisol amounts needed to help the body to meet the elevated metabolic demands. That means the patient immediate uh, action like the adrenal can never secure the adrenal. So what will happen? There will be adrenal crisis will be happen. So patient at the risk of acute adrenal such as risk of adrenal suppression as well those who are taking at least 20 milligram of steroid or its equivalent daily for at least 2 weeks anytime during the year preceding the planned major or surgical procedures. So what are the symptoms we can see in this type of patients? That abdominal pain, confusion, feeling of excessive fatigue, hypotension, myalgia, nausea, patient in the partial and total loss of consciousness and weakness. These are the main signs and symptoms we can see in the patients. So, how will you manage this type of situation in a dental office? First, you terminate all the dental treatments. That if you are going for a crown preparation or root canal, anything, you terminate all the dental ones. You remove from the oral cavity. Then place the patient in a supine position with the legs raised above the level of head, and you will do call the medical assistants. And if they having medical emergencies, we can give 100 milligram cortisone or IM or IV and administer oxygen and monitor all the vital signs, patient's BP, pulse, everything, and start IV line and the crystalloid solutions, and start the basic life support. That means airway, breathing, circulation. You check it out. If the patient aeration, then do that thing and transport the patient to the emergency care facility. So, what are the suggested management of patients with a history? That means the patient having history of steroids. What are the things you will do? If the patient is coming, that type of patient coming to your clinic, if you're going for a consignment, that means you're going for a filling, normal extraction, single tooth extraction like that, no, underly. So what are the things you will do? Any treatment, normal cases, what we'll do is first the steroids are taken to the previous history around 12 months. Then normally you will give oral steroid. That means prednisone 10 mg dose in the morning or hydrocortisone. That means 10 milligram of prednisone morning or hydrocortisone 20 to 50 milligram IV given preoperatively. That means before the procedure we'll give this medication. If the steroids are currently taken, that means patient is continuing now steroid, then double the oral steroid. 10 milligram steroids will give in the morning, or hydrocortisone 20 to 50 milligram IV prior to this procedure, and continue normal steroid medication posteriorly. So first case we will do only prednisone 10 milligram on the morning or hydrocortisone 10 priority. But in the second case, we are giving continue giving it more preoperatively and posteriorly will given the dosage of steroid. So if you're going for a multiple excision or going for a under anesthesia procedure, in these cases steroids are taken during previous of 12 months. The patient has taken a drug for previous of 12 months. Then what will do? The same, the oral steroid like a prednisone 10 milligram in the morning plus. That means the previous case will give or, but in this case we'll add plus hydrocortisone 20 to 50 milligram IV prior to this procedure, or IM 6 hourly for 24 hours. So we'll add prednisone 10 milligram plus hydrocortisone 20 to 50 milligram, give preoperatively the procedure. If the steroids that currently they're taking, that means long steroid therapy, what will do? Double the steroid more at prednisone 10 milligram plus hydrocortisone 20 to 50 milligram IV preoperatively and IM 6 hourly for 24 hours. Then continue with the normal medication. This is normally going for the multiple tooth of extraction and going for the major surgical procedures under GP. So what are the clinical features we can see is the patient having hypotension, depression of the myocontractility, hypoglycemia, patient having abdominal pain, nausea and vomiting, and mental confusion. So what are the management will do if the patient is conscious? So first you assess the patient, terminate all the dental procedure, and patient position comfortably if the asymptomatic supine with the feet elevated slightly. Then check the airway, breathing, circulation. If BLS needed, give BLS and monitor all the vital signs. Call the medical assistants and give the emergency kit like the oxygen, administered glucocorticoid. Then if the history of adrenal exists, then consider the additional manual like progressive VLS and progressive, and give glucocorticoid. That means 10 milligram prednisone we can give, or give through IVSS. If the patient is unconscious, what will do? First you terminate all their treatment procedure and patient position with the feet elevated slightly and check the airway, breathing, circulation, and definite care like medical assistance and emergency kit and the oxygen therapy. Evaluate the medication and monitor the vital signs and call the medical assistance. These are the things we will do in the adrenal insufficiency case. Next one is anaphylaxis. Anaphylaxis, you already studied in the second year, it's a type 1 hypersensitivity reaction. Potentially, it's a life-threatening hypersensitivity reaction to an antigen. So, immediate seconds to minutes will take an antigen induced and the antibody mediated. So, immunoglobulin E is mediated. So, mostly in the dental practice, mostly due to the antibiotics like penicillin, cephalosporin, tetracycline, sulfonamide. These are the antibiotics that can leads to allergic reactions. Not all the this type of antibiotic that leads to anaphylaxis. Certain patients they have a history of the genetic disorder like that. No, they have a chance. So the analgesics like acetyl acid and NSAID also will lead to hypersensitivity reactions. Opioid like fentanyl, morphine, codeine like that. Anti-anxiety drugs like barbiturates. Local anesthetic drugs like ester, sodium metasulfate, methylpyramine, the preservatives like that, that leads to hypersensitivity reactions. And other agents like acrylic monomer, mostly using in the prosthetic that denture purpose, that also can lead to allergic reactions. So what are the signs and symptoms we can see? Mostly we seen first with the facial flushing. Facial flushing that means the patient having skin rashes. Everything will be erythema. Everything we can see on the body and parasites, edema or urticaria or peripheral cold cum skin. At the same thing, we can see the running nose, conjunctivitis, wheals and itching. These are the things we can notice in the skin. And the patient have a stutter or wheeze. If the means the stutter means the patient inspire the air, we can see a whistling sound. And also the patient will experience the wheezing sound we can notice. So if you're using the stethoscope, you can see a whistling sound on both inspiration and expiration. And the patient having abdominal pain, nausea, and there will be loss of consciousness, pallor going to cyanosis, and rapid peak or impalpable pulse, and also hypotension. So mostly the patient having difficulty in breathing, nausea, breath, wheezing, then cardiovascular low blood pressure, rapid pulse, cardiac arrest, and the patient having abdominal pain and vomiting. So how will you manage hypersensitivity reaction? First, you secure the airway. If the patient having difficulty in the breathing, so go for the intubate the patient endotracheal to place and 100% oxygen flow, high flow air 15 liter per minute, and maintain the position and give adrenaline 0.5 milligram. That means the concentration is very important. 1 is to 1000. You are giving IM repeatedly 5 minutes, guided by the vital signs. So if the adrenaline is giving to the patient, IM 1 is to 1000 the concentration, very important. And secure the IV as is like a chlorpheniramine 10 milligram IV or hydrocortisone 20 milligram IV. IV fluids like a 0.9 saline, 500 ml up to 2 liter titrated and aims the PP. So this is the most important part for the management of anaphylaxis. And if the patient is unresponsive, Then with no pulse, adrenaline can give given, so the concentration will be different. 1 ml, that means 1 is to 10,000 will dilute solution per minute. Stop as soon as response is obtained. So the algorithm is looking for the anaphylaxis. The first one is the anaphylactic reaction is noticed and check airway breathing, circulation, disability, and exposure. Diagnose of the acute onset and illness, life-threatening airway, and go for the skin changes. We can call for the help. Raise the patient legs, then they give the adrenaline, the same thing. Start the airway, high flowing oxygen, IV fluid give, then monitor the pulse, ECG, blood pressure. So the same thing, little different for the pediatric also. Next one is angina pectoris. Angina pectoris is a severe chest pain is usually caused by angina or less commonly myocardial infarction. So the patient will be unstable angina, and those who have recent history of hospital admission or ischemic chest pain have a highest risk and should not be considered the routine dental treatment in the primary care. So it is also a very important thing. So what are the signs mostly seen in the angina? The symptoms we are showing that patient having pallor, cold sweat, chest pain, shortness of the breath, changes in the heart rate, increased respiratory rate, low blood pressure, confusion, loss of consciousness. These are the symptoms. If the patient having severe, no, then it will be crushing pain in the center and the across the front of the chest. Pain may be radiating into the shoulders, arms, necks, and jaw. Shortness of the breath, weak pulse, falling blood pressure, and nausea, vomiting. So these are the uh, signs and symptoms we can notice in the patient. So the types of angina is stable angina, variant angina, and unstable angina. These are the three types of angina we can notice. So the normally the mild symptoms is the patients previous diagnosed with the angina. So normally they give admission glycinate 400 micrograms, or uh, mostly they are giving like that only. So if the frequency of angina is one per month, then so the patient ability is patient can walk 2 levels city blocks or climb 1 flight of stairs. So the American Society of Anesthesiology, the status they may showed, no, it's considered as two. So the emergency drugs like oxygen we can supplement. So mostly the emergency drugs will be there in the dental office. So the frequency of angina is 2 to 4 per month. So patient can walk 2 level city blocks or they climbs 1 flight or stairs. So the same thing, yes, will be 2. But the possible things, pre-medication of nitroglycerin 5 minutes before the therapy and supplementary oxygen. If the patient having 2 to 3 per week, then patient develops before pain will be there, and patient walks 2 levels city block or climbs the stairs. So the ASA classification be 3, and possible pre-medication with the nitroglycerin 5 minutes before the therapy and supplemental oxygen. If the episode is more, so the patient got unable to walk 2 levels, so is ASA4. So better the ASA4 will never touch the patient. That is most important. We'll refer the patient to the hospital. In hospital, this thing, hospital care only we can do this type of case. So what's the treatment plan for this case if the patient having uh, symptoms of angina? Determine the procedure, position patient comfortably, airway breathing circulation. The care will be history of angina, then administer nitroglycerin, administer oxygen, and pain results modify the future dental care. If the known history of angina, call the medical assistant, administer oxygen, administer nitroglycerin, and the monitor vital signs. If there is a no response or if the pain resolves and returns, call medical assistants, administer fibrinolysis and monitor the vital signs. So better we'll refer this type of patient to the transfer to the patient to the emergency care. Next one is the asthma. Asthma is like a chronic inflammatory disease of the airway with the spasm and narrowing leading to the obstruction of the airflow. So the anxiety, infection, or exposure to antigen drugs may be persuade the asthma. So high risk includes like the induced like taking oral medication in addition to inhaled beta and agonists and steroids, who regularly using the nebulizer at home and require oral steroids for their asthma within the last of year, who have been administered to hospital with asthma within the last year. This type of patient we can notice the asthma. So the diagnostic features we can see uh, mainly breathlessness, respiratory wheezing sound will be there. The use of accessory muscles struggling the shoulders with each respiratory cycle with increased severity. And rapid pulse will be there. The pulse will be 110 per minute with increasing severity. But this may slow in the life-threatening examination. So the thing there we can see the beeping sound using with this stethoscope. I am not able to talk with the full sentence and the respiratory rate will be increased. That means 25. And accessory muscles will be used, exertion, and the pulse will be less than 52 and greater than the 110. So confusion and sinuses we can notice in this type of case. So mild asthma attack, what are the things we'll do? Give oxygen to the patient and salbutamol inhale to activations and observe for 45 minutes. If frequent reassessment and will get follow. So patient having mild asthma attack like that, no, we can manage. But if it becomes severe or moderate, no, then we'll call for the medical assistant. So the severe attack, no, the patient observe the patient raises the airway breathing circulation, definite care regularly, and oxygen high flow the supplemental that means 15 liter per minute. Salbutamol inhaler via space that 10 activities will be used. Next one is seizure. Seizure it's called the epilepsy. Uh, do not attempt the restraint. That means attempt the placing anything between their teeth. So the various factors that preserving a fit, including not eating. That means the patient eating any cessation and anticonvulsant therapy. But most of the patient, like epilepsy patients, they will inform to the doctor before the starting the procedure. Some patients they never inform, so there may be more risk. And if the patient having the inflammatory menstruation cycle and some drugs that can induce a seizure, such as alcohol, flumenoxazole, tricycline, antidepressant drugs. And which may affect the people who have no history of epilepsy, especially through the hypoxia from loss of consciousness from other reasons or in hypoglycemia. So the seizure exhibited in many ways, ranking of the grand seizure with a frightening display of chronic contortions of the trunk and extremities. And the other one is a collective mass seizure that means only the episodic absence. The injury induced brain damage or damage from the ethanol abuse, no, that can also cause seizure. So anti-seizure medication like a phenytoin, phenobarbital, and or valproate are commonly drugs they are using. Dentists should not find out the degree and the patient's seizure control and ability. Patient's ability to change air must be monitored, placing her or head in moderate extension and moving the manual airway from the pharynx. Patient's head must be positioned to the side to allowing obstructed materials to drain out from the mouth. So if if you are going to do a seizure patient, you must careful, never obstruct the patient's airway, everything. Sometimes if you're placing anything in the oral cavity, they can swallow very easily. So high volume suction should be used for the evacuate the materials. Placement of the objects placed in between the atom to prevent the tongue biting and others therefore should be avoided. Continuous or repeated seizures without periods of recovery between the not called as status epilepticus. Common type of seizure disorder will cause mortality that tremors, palpitation, and extreme anxiety usually precedes the seizure cause the ethanol withdrawal. So some patients they are taking alcohol, the sudden removal of the ethanol that will all lead to the seizure. Control is usually obtained the use of the benzodiazepines and usually then obtaining the ethanol. Abusing patients are treated similar manner as the other seizures. So how will you diagnose null? First one is the loss of consciousness with a rigid and extended body with sometimes precise with a brief cry, widespread of jerky movements and possibility of incontinence of passing of the urine and feces, slow recovery with the patient sometimes remaining the days that called a post-ictal. So how will you manage the epilepsy? Airway maintenance and the recovery position, remove the dangers inside the oral and airway, nasal airway, intubate if necessary. 100% oxygen will give and plus suction as necessary. IV fluids like will give, so we'll go for the routine examination, the liver function, the fasting blood sugar, everything will, and the calcium also will check, correct the hypotension with the fluids. Thiamine 20 to 50 milligram IV if alcoholism or malnourishment suspected. Glucose 50 ml 50% of IV if hypoglycemia suspected. So the always stop the seizure, the slow IV pulse phase at lorazepam 2 to 4 milligram IV or over 30 seconds is large vein. Second dose even if there is no response if within 10 minutes, or diazepam 10 milligram IV or buccal metazolam 10 milligram. IV infusion phase, then we'll give the phenytoin IV 80 milligram per kg at around 50 milligram per minutes. Monitor the ECG and the BP. Diazepam infusion 100 milligram in 500 ml with the dextrosatine 40 ml per hour. General anesthesia phase the paralysis and ventilation with the conscious EEG monitoring. Next, hyperventilation. It is the excess of that required maintain the normal blood of partial pressure of the oxygen. That means arterial oxygen tension and partial uh, carbon dioxide. So acute anxiety is the common predisposing factors. Palpitation, tachycardia, dizziness, numbness, and tingling of the extremities, pericardial pain, disturbance, tension, tremors, stiffness, and cardiac technique. So prolonged anxiety is also mostly distributed to anxiety, prolonged rapid breathing, and leads to fall in the arterial carbon dioxide, acute respiratory alkalosis, cerebral vasoconstriction, and there will be loss of consciousness. These are the things. So, what are the pathophysiology? The anxiety, respiratory alkalosis, hypercapnia, increase in the blood catecholamine level, decrease the level of ionized calcium level. These are the pathophysiology. So the management is the termination of all the dental procedure, position of the patient's airway, breathing, circulation, which are calming and reassuring the patients, and increase the partial pressure of the carbon in the patient's blood, may making the patients rebreathe and exhale air. Breathing into the cupped hands or face mask will use drugs if necessary according to the patient's vital sign. Next one is the hypoglycemia. It is due to the blood glucose level below the 3 mmol per liter. An acute hypoglycemia clinically occurs in the patients who have diabetes and who fail in eating and after taking the insulin. So it's the most dangerous complication in the diabetes because the brain becomes starved of glucose and damage due to with the treated with the insulin. Those who have poor glucose control or poor awareness of hypoglycemic episodes have a greater chance of losing the conscious. So most of the patients is for the dental extraction. Before starting the procedure, you ask to the patients that skip their medications and their breakfast. If they skip both the things, there will be higher chance of hypoglycemia. So it will become most a danger complication in the diabetes. So what are the signs and symptoms we can in the patients? Mostly, if you check the blood sugar, it become around 5, 4 like that, no. So deepening the drowsiness, disorientation, anxiety and aggressiveness, sweating and tremors, convention impair the consciousness of coma. So a person with the untreated insulin dependent type 1 diabetes or constantly runs with the risk of developing ketoacidosis and its attendant alteration of the consciousness requiring emergency treatment. Severe hypoglycemia is the emergency situation of the dentist are most likely to face when providing oral surgery for the patients with diabetes. So acute manifestation of hypoglycemia mild like a hunger, nausea, mood change, and weakness. If the patient having moderate, the anxiety, behavior change, confusion, uncooperateness, pallor, perspiration, and tachycardia. A severe case will be hypotension, seizure, and unconscious. Mostly the hunger, trembling, sweating, slurring of speech, difficulty of concentrating, confusion, headache, seizure, unconscious. These are the most common things we can notice. So the treatment plans are the mild case administer the glucose with like a sugar or a fruity by mouth, monovitamins, and before further dental care, consult the physician. If the patient having moderate hypoglycemia or administer glucose source such as fruit juice, sugar with fruit juice, motor vital signs. If the symptoms are not progressive, then administer 50% of glucose or 1 ml of glucose IV or intramuscularly and send the patient for physician. The patient having TPR administer 50% of glucose IV or IM 1 milligram of glucose and some of the medical signs, motor vital signs, administer oxygen and transport emergency care. So what is normal things we will go for the airway breathing circulation, check the random blood sugar less than V3, conscious patient glucose, drink carbohydrates, bread, biscuit like that. Unconscious patient give glucose 1 milligram IV 1 text was already told. Vital signs every 5 minutes and administer oxygen. So in this topic, these are the main things we notice: adrenal insufficiency, epilepsy, hyperventilation, anaphylaxis, hyperglycemia. Mostly we can see in the patients like the patient having long schedule like that and the patient having diabetes. No, it is very important because most of the patients like diabetes they are not they want to reduce the blood sugar then only they can come for exercise. So what they will do, they will skip the breakfast and the drugs that will lead to hypoglycemia. So this is a topic regarding of the medical emergency. Thank you.